Chief Minister Conrad Sangma, in the presence of Health and Family Welfare Minister Dr. Ampareen Lingdaw, today inaugurated the North-East Tuberculosis Free Summit held at Courtyard Marriott in Shillong. The summit was organized by the Department of Health and Family Welfare in collaboration with WHO Country Office India. In his inaugural address, Chief Minister Conrad Sangma said that healthcare is one of the top priorities of his government, and over the last few years, the government has continuously engaged and invested in healthcare and adopted different strategies for ensuring quality healthcare in Meghalaya. He said that community participation, enhancing nutrition, treatment innovation, tech integration, wellness and prevention interventions such as awareness about the disease, early screening and maintaining hygiene are some measures that can accelerate the goal to make India TB-free by 2025.
As doctors, you investigate, but even as government, as policymakers, as an administration, we need to investigate and realize what is the real cause of the problem. When it came to MMR for Meghalaya, institutional deliveries was one part, but we realized that there was a problem because high-risk mothers did not have the accessibility that they required to the medical professionals or to even an ambulance when they needed it the most. We realized that because of maybe economical engagement of mothers not being enough in society, we were seeing the gap between the birth of two children being very small, like 1 year, 1.5 years, which was very high risk for the mother. And hence, maybe the solution was not just simply the institutional deliveries, but it was economic engagement of the women in our society. And hence that led me to move very aggressively on what we had and what we're doing today, a self-help group movement of women, where in the last 5 years, I had 4,500 self-help groups, but this information and this, the result or the problem that we could see encouraged me to increase the number of self-help groups today from 4,500 today in 5 years' time to 45,000 self-help groups in my state. There is one woman from every family today who is engaged in a self-help group. It's a huge milestone, and these women are today economically active. Remember, there is no solution that is going to work across. You have to adapt the solutions to your needs. And Northeast is very complicated. It's very diverse. We have different practices, different beliefs, different culture, different terrain. And hence, we need to realize all this and ensure that we are able to find solutions by doing detailed analysis of what is the problem. Everything starts with your mindset, your thought, and your belief and your passion. Remember, no matter how many doctors we have, no matter how many nurses we have, no matter how many ministers we have or how many officials we have, if your heart is not in the right place, if your mindset is not correct, nothing can happen. Nothing can happen. So I urge all of you, when we are taking up a mission, let us take it up with full commitment and passion. Let us take it up with a sense of purpose that we will do it and a determination that we will do it.
Health Minister Dr. Ampareen Lingdaw in her address said that a robust preventive procedure and concerted effort and continued focus with the participation of the community is necessary to eradicate TB.
We need now to move ahead from this simplifying of the word tuberculosis. We need to provide for a robust preventive procedure, and we need to concertedly continue focus to ensure that spread of tuberculosis is something which will happen on the ground. I personally come from a very urban constituency, and let me share with you that families have been wiped out. wiped out completely due to tuberculosis in my own constituency, where healthcare is just an arm distance away. But our state has taken very, very positive steps to ensure that the preventive model is operationalized. And tuberculosis is a very, very high cost effective treatment, and we are so grateful that the Honorable Chief Minister has simplified the health scheme of the state of Meghalaya, and thousands of tuberculosis patients are now sincerely recipients of a cashless tuberculosis treatment. That's very important. Causes of tuberculosis again is something which we still need to advocate. Lifestyles of individuals, without getting into details, sometimes circumstantial situations that families grow up in, the fact that we still use even cooking materials which can to a large extent compromise our children as they are born to the time that they grow up, and they are still vulnerable. And I'm happy that the Honorable Chief Minister has just embarked upon a mission to improve housing facilities for rural Meghalaya. If you come to some of our rural homes, you'll be shocked at the way that our citizens have conditioned their lungs and their other organs into this kind of a life where housing facilities, healthy living conditions is still quite a big challenge in the state of Meghalaya.
WHO representative to India, Dr. Rodrigo H. Offrin, said that the summit is not only to celebrate the efforts of the Northeast in TB eradication programs, but also to spread the word to other parts of the country about the good practices and learn from each other.
5 years ahead of the SDG goal to end TB. We have done a lot. As you can see on the screens around you, these represent all the videos, the films of the best practices around the state, whether it is the mobile X-ray and lab sample carrying around Meghalaya. You also have the traditional healers being trained and engaged in active case finding here in Assam and Meghalaya. Integration of the national health integration of TB in the national health program. It's happening in Tripura, and of course the impact of all your efforts in increasing active case finding. We have seen that the presumptive case numbers are really reaching highs all over the Northeast. So congratulations for all of that. I think it is really deserved a good hand, and that's why we are having the summit, which will solve us and bring us to the end of TB. We are in our last miles, and this is what is needed. More importantly, I think the next part of my talk is that we have more to do. It's not just that we celebrate our good practices. We need to scale those up, spread it around, spread the information. It may be useful for other states across the country, or even other countries. Every state has its own state plan, and we have to push towards its implementation, but more importantly, the TB Mukh Panchayat plans of every state. A TB-free village will be a healthy village, and I think that will be the core of the push of where this will start. Well, where will TB start and end? A TB-free village is a healthy village, it's a healthy state, it's a healthy Northeast, it's a healthy India.
At the program, the Chief Minister also launched the Meghalaya Mobile Portable AI-based X-ray Diagnostic Facility. Also present at the program were Deputy Director General TB Government of India Dr. Rajendra P. Joshi, NAGRIM's Director Dr. Nalin Mehta, Secretaries of Health from Nagaland and Manipur, representatives from other northeastern states and senior officers from Health Government of Meghalaya.